Dr. Najy Masri of Oschner Health is a physician down in Metairie at the medical center in Kenner, actually, and a huge Pelicans fan. I think he's got a couple of tickets in Section 124 and has been going to Pelicans game for a long time. In fact, he was going to load up and head over to a game last week and travel with the Pelicans, but then the news came that the NBA was calling off the season, and much like everybody else, he was like, wait, what?
Would have been Ja versus Zion, a seed on the line, Grizzlies, Pels. It was all lined up to be spectacular.
Top 2 rookies in the league. The doc had a plane ticket, was going to check it out, but he was, with the NBA season being called off, that trip was called off. And he can give some medical expertise here to a lot of the decisions behind that and kind of what could be. And, Doc, we appreciate your time this morning. Thanks for jumping aboard with us.
Thanks for having me, guys. How y'all doing?
Absolutely. Thank you. When you got the first bit of news from the NBA and saw it like the rest of the world did, what was your initial reaction?
It was tough. I was excited. I was going to go check out Zion and Ja in Memphis and catch that as a big game for us for the future. And I actually canceled the flight probably about 2 hours before the NBA came out with their announcement that night we played the Kings.
And so I guess this kind of preamble, Doc, is to say that you are someone who loves sports, right? Like, obviously, you're very involved. You love sports. Was it the right move for the NCAAs, the NBA, for all the different sporting leagues to go ahead and suspend or cancel play? Was it the right decision?
Absolutely. You know, this virus, the trick about this virus really lies in the fact that you can be asymptomatic and still contagious. So you can walk around and you can spread this virus and infection to others and not even realize it. If you look at some of the data right now, we're pretty much as a nation following the same trajectory as Italy. We're about 3,500 deaths, 3,500 cases, over 60 deaths. And if we look forward and we continue to follow that trajectory, Italy is now about 25,000 cases, 1,800 deaths. I think the other day they announced 368 deaths in one day.
Yeah.
And this is a country that's on par with us as far as healthcare. So the real need here is really the emphasis on social distancing. That includes avoiding large gatherings. The CDC yesterday released a statement saying they wanted to avoid any gatherings more than 50 people for the next 8 weeks. So mom and dad's out there. I don't think the kids are going back to school in a month. Pelicans fans, I don't think we're going to be sitting in the Smoothie King Center anytime soon watching Zion.
Do you think that the NBA could resume in June?
I think there's a possibility of a truncated season. I think if they did do that, I think it would still be played in empty arenas. It would be nice to have that back to bring a sense of normalcy, to at least watch it on TV. But anything that involves people getting together in the foreseeable future really is not something I see happening soon.
We're talking to Dr. Najy Masri here on Off the Bench, 104.500 with the 94.7 ESPN. And, Doc, there's all this talk about flattening the curve, right, in the healthcare infrastructure, and beds, and how this could overwhelm hospitals. You've lived it. Can you give us some, boots on the ground perspective about how easily it can get overwhelmed, or maybe some context about what even a normal flu season is like?
Absolutely. I work in a hospital system, like most hospital systems across the state, across the nation, that during flu season, you're at near capacity. And so hospitals are not equipped to handle the degree of sickness that comes with this virus if it's spread rapidly like it is. So the key, again, all of us can contribute to decreasing the amount of spread by true social distancing. I think yesterday, Mayor Cantrell released a statement at night that talked about closing the restaurants and bars, or restaurants at 9, the bars at midnight. I'll be honest, I don't think that's enough. If you look at New York, Los Angeles, they've enacted bigger measures. They've closed all restaurants and cafes. They only offer takeout service. Any places of gathering, movie theaters, arcades, bowling alleys, those are completely closed. Pharmacies, groceries stay open. This is the kind of enactment that we need here in the city and the state. We have to get ahead of this. And the plan that was laid out yesterday by the mayor is not enough. We have to have true social distancing to avoid this spread.
Dr. Masri joining us here, ESPN Baton Rouge, New Orleans, and Alexandria. It seems as if the numbers compared to the national look here within the United States, New Orleans is tracking pretty quick. Can you take us inside the city and what's going on with the virus?
Absolutely. We had our first case about a week ago. We're now already over 100 cases with 2 deaths. That puts us about number 4 per capita in the United States, behind only Washington, New York, and Massachusetts. So we have to do something. We have to do something now. It's like, you guys know, it's like we were just playing defense. Like LSU before Joe Brady and Joe Burrow, we got to play offense. Right?
This is Les Miles' LSU football program.
Yes,
I get it. I get it.
Les Miles football. We need Joe Brady, Ed Orgeron football. We got to play offense. Offense is social distancing, true social distancing to do that. And part of that, for the people whose jobs are affected by these closures, we need some federal bailout money.
Yes.
We need people that can be helped so that their jobs don't impact their livelihood, their ability to pay their rent, their ability to pay their bills. We need 1 to 2 people going to the grocery stores. We don't need 8 people in the family going to the grocery stores. Ask your family what they need. Ask your elderly neighbors that can't go to the grocery store, what can I get for you? The kids whose lunches are affected by schools, we need to provide those kids lunches, like I'm starting to see happen. But people can impact this. We can truly impact this as a community, but we got to have real social distancing.
This is great information from Dr. Najy Masri joining us here on Off the Bench. You mentioned the facility, and that being what you guys are trying to play defense against is the amount of people coming into the facility. All those actions and practices of social distancing can prevent that. How dire is that situation right now? Is it still on a pace where it'll be able to keep up, talking about the medical facilities and the amount of patients coming in?
I think we're just starting. I think this is going to get to the point where a lot of our hospital systems are maxed. I should take a moment to give a shout out to all the doctors, nurses, respiratory therapists, everybody out there that's putting themselves in harm's way to try to take care of our sick.
Amen.
But these hospital systems are going to be really taxed. Now, I think we're ready. I think we're prepared for it. But the community can do something to help us out, and that's to employ a true social distancing. We have to have more drastic measures than what was laid out by the mayor last night.
Wow.
Doc, tell our listeners how they can find you, how they can find information, how they can find you on social media.
Absolutely. I'm on Twitter. I'm on Facebook. I'd be happy to answer anything. Send me DMs. I'd be happy to answer any questions. I'm going to try to continue to spread this word, because I really think this is something where the community can have a big response.
Doc, Rivs is going to get your information on the air. She's the one that set this interview up, and it was fantastic. We're interested in getting you on weekly to answer listening questions about what's going on in the coronavirus and just keep us up to speed. This was fantastic this morning.
Thank you. I'd be happy to do that.